I'm often asked if health centers can lobby. The answer to that question is yes, and they should lobby. With 75% of the average health center's budget controlled by the actions of federal, state, and local governments, it's critical that they hear from health centers, the staff, and the patients that health centers serve. There are some limits to what health centers can do, however. When it comes to lobbying, health centers cannot use federal grant funds for any lobbying activity. Health centers should try to keep any lobbying expenses to less than 5% of their budget. And health centers can't do anything that would be considered partisan political activity that would indicate they support or oppose any specific candidate or political party. In order to determine what kind of lobbying you can do, people need to understand what lobbying is as far as the government is concerned. The legal definition of lobbying is communicating with any elected official in support of or opposition to a specific piece of legislation. That's considered direct lobbying. The other kind of lobbying is grassroots lobbying, which is communicating with the general public, asking them to support or oppose a specific piece of legislation. Just as important is knowing what isn't lobbying. Communicating with elected officials or their staff to simply educate them about issues important to health centers, or about the need for health centers, or about supporting the growth of health centers, for example, is not lobbying. Responding to questions from elected officials to give them information about health centers or even about specific issues is not considered lobbying. Health centers can do any of these things. As an individual, health center staff and board members can lobby or support candidates however they choose, as long as they make it clear they are not doing so on behalf of their health center. Once you know that you can lobby, and once you begin to lobby on behalf of your health center, what's the best way? The best way is to get your elected officials to visit your health center. Nothing you can say, nothing you can communicate is as effective as having elected officials visit your health center, see what you do, see who your patients are, and see how important you are to your community and to their constituents. Getting them to your health center to see what's going on is going to be the best thing you can do. After that, the next best thing is to meet with them person to person, away from your health center. You can meet with them in their office in Washington when you come to the NAC Policy and Issues Forum. You can meet with them when they're back home in their own offices. Again, the important thing is that they see your health center as the people that work there and that it serves, not as just numbers. If you can't meet with your elected officials and you want to try to lobby them or influence their actions, the next best thing is to write them a letter. A personal letter to your elected officials telling them why your health center is important and why you need their support. Giving them your own personal feelings is the next best way to make sure they understand what you're asking them to do and why they should do it. After a personal letter, we get down to things like phone calls, emails, and faxes. The value of email and faxes only comes if we send a lot of them. If they hear from a lot of people, they figure that an issue is important. They don't hear from many people. The fact is, it's just not an issue they're going to care about. Phone calls are a way to get to elected officials and their staff on short notice. When an issue is about to happen on the floor of the Senate or the House, when we need to communicate with them quickly, a phone call when you can talk to the elected official or their staff is really important. Again, if you've done your homework in building a relationship with your elected official, you'll be able to talk to them and they'll know what you want by a simple phone call. Lastly, in order to be able to build our advocacy effort and to move the Access for All America plan, we need to have more advocates working for health centers. Get everyone at your health center and as many of your patients as you can signed up for the NAC advocacy list through our voter voice system. Again, getting more people to communicate with elected officials can have a tremendous impact because it demonstrates to them how many people care about health centers and the future of health centers. It's up to all of us to work together to build the kind of relationships and to build the kind of advocacy effort that's going to make the Access for All America plan a reality.